Okay, everybody, it is 4:30, and if we do one thing right around here, we get started on time. So just wanted to thank everybody for coming this afternoon. My name is Melinda Plew. I'm Director of Advocacy for the ARC of North Carolina, and you are attending what I believe is our third webinar in a series that is tackling Medicaid transformation, some of the changes that are coming in North Carolina and have been occurring over the past year. We know that if you are a family member, it is confusing. You might be hearing mixed messages and things are changing. So this is our attempt to try to help you better understand what is happening as things are changing. Just wanted to remind you of a couple of things. One, you guys aren't able to speak or come on camera as this is a webinar. So if you have questions and you want the opportunity for us to answer them live today, please use the Q&A down there at the bottom of your screen, and we will read your question out live so that we can answer it. We have been collecting some questions through a link that we sent out through our social media earlier or last week. So we'll also be tackling those. We have with us today John Nash and Lisa Petit, Deputy Director and Executive Director for the ARC of North Carolina. And I am going to turn this over to them. This is being recorded. If you hadn't already figured that out, we will post the recording and a transcript, as well as a Spanish translation of today's webinar as soon as that becomes available within the next week or so. It takes a while to get that translated. And all of those things will be posted on our YouTube channel, which you can get to easily from the ARC of North Carolina's website, but we will get all that information to you. So with that, I am going to turn it over to John and Lisa.
Thank you. As we start, a couple of things I want to make sure everybody is aware of. First off, this is for everybody, us included. This is complicated stuff, and so we're trying to keep it workable on a layman's terms level. That said, I will apologize in advance because the likelihood is I'm going to be somewhere between start and stop, and probably several somewheres. Myself, Lisa, Melinda, one of us is going to probably use a term that makes no sense to anybody. We'll use an acronym. My apologies, it is unintentional. Please call us on it when you do it. Put it in the Q&A, put it up in the chat. Let us know that we made a mistake. And for us, it is hard because when you use these terms every single day, you don't think about LMEMCO. That's a term that I get questions on. Some people know what it is, others may not. I'm not going to explain it to you right now. We will try and stay away from those kinds of things as we talk. That said, my guess is that we will use those terms somewhere between start and finish. So please do not hesitate to call us on it. Our board of directors does the same thing, and it is certainly not offensive. And I would rather have you understand what we're talking about and be clear on those things. So yeah, again, apologies up front, and we will do our level best to not let it happen. And we look forward to you guys keeping us true to that commitment. So Lisa, anything else you wanted to add to that?
Ditto. We're not speaking in acronyms, and we'll do our best to explain what those are if we do.
So with that in mind, as we get started, Lisa and I talked about just some things we wanted you to be thinking about up front. Again, we don't have all the answers. As a matter of fact, we may have more than some, but we certainly don't have all the answers, and I'm not sure that anybody does. There are some things that you ought to be aware of that are about to happen. With Medicaid transformation, you may have heard the term Taylor Plan. You may have heard, my services are going away. Those things, the services are not going away, first off, but we need to talk through some of those questions. The bigger issue is, what do I do and when do I do it? There are announcements, and letters should be going out beginning the first of next week. They may already be in the mail from the Department of Health and Human Services. Keep an eye out for those letters because that's got some critical information that you need to be aware of. You'll know that letter because it'll have the nice little state logo, the Department of Health and Human Services up in the top left-hand corner, and it'll be probably 4 pages of information some of which is going to be confusing, some of which, I've had to wade through a couple times to make sure I'm clear on some of it in there. But it's important to know that it's going out tomorrow. The deadline to respond to these letters is October 14th. So if you get it and think, oh, I need to take care of this right now, don't panic, especially because it's asking you to choose providers and to choose care management agencies. It's going to ask you to make some choices, except those choices are not available to be made yet. So they're giving you the letter, but you can go to the website and say, well, I want to work with the ARC, for instance. Well, not the ARC, none of the other provider groups that would be doing care management are available. So if you choose it and you go find us, it's not going to show up because none of these agencies that'll be doing this have been populated into the fields yet. That probably won't come maybe till to the end of September. So like I said, don't panic because it's not there. Just don't feel like you have to act immediately. What else on that opening letter that you should be looking for, Lisa?
Don't throw it away. I would just say to everybody, it's the letter will be complicated. It's not going to make a lot of sense. Some parts of it are going to be more valuable than others. Just hang on to it. Like John said, you will be expected to choose within your tailored plan network a physician that is in the network, and later a care management agency. Those care management agencies will be populated in those lists later. The choice period actually starts Monday, August 15th, but doesn't mean you have to choose on the first day. So we're advising people, be patient, wait for those lists to populate. There are a lot of things that have to be processed right now. People are going through reviews and getting contracts ready. All these organizations are in different states of being able to contract to do these services with the tailored plans. When those contracts are done, those lists will be populated. And those lists, we've been told by the state and the tailored plans, they will refresh those lists daily. So once those organizations start to populate the list, they should start growing daily. You could easily wait until late September, early October to even look for those lists or start making your choices. But do be aware those letters will tell you what tailored plan you're going to be in, who's going to be managing your services in this new system, which tailored plan that will be, and it will be the current LME MCO that you have now, unless you're moving to a different region of the state. And it will advise you to choose a doctor and then choose a care management entity. And remember, the choices for care management entities are the tailored plan itself, they will be providing care management, or a provider called a care management agency, like the ARC of North Carolina, will be providing care management. So will many other providers. Or there are some larger doctors groups who will also be providing care management. They're called advanced medical homes. There may be about 10 of those around the state. They're a little bit more rare than a care management agency, but those doctors groups and care management agencies will eventually populate that list, so you'll see what choices you have. I will also add to that, John, if people don't choose by October 14th, the magic date when the choice period ends, on the 15th, they will choose for you. So, with the ARC, we believe strongly in choice. We'd like people to make their choices for themselves, but be aware there is a deadline, October 14th. On October 15th, they will start choosing for you and assigning you to a doctor and a care management entity.
By the way, in case you are concerned that I have to make this choice and you make the wrong one, because all this will be online. The list will be online. There will be a link in the letter you get and places where you can go and start filling all these blanks in, and the list to choose. That'll all be an online application. If you click the wrong buttons and you think, oh no, that isn't the one I wanted to do, choice being such a critical element of this, you will be able to go back and correct that and make changes. So you don't have to choose before the 14th. If you do, great. If you don't, and they choose for you, you can still go back and change that to something that you do want. So there's a lot of flexibility being planned into this up front.
John and Lisa, if this might be a good time, the question came in already that said, will this letter be coming from the state? Will it say NCDHHS or is it going to say DMA on the envelope so that people are looking for it?
It will say, it'll have a great seal of the state of North Carolina in the top left-hand corner. So it's that big circle with two ladies standing there, one sitting on a cornucopia and one holding a staff. And it'll be from the NC Department of Health and Human Services, Division of Health Benefits. That's where it's coming from. So it'll have the seal of North Carolina and those words on it, NC Department of Health and Human Services, Division of Health Benefits. And it's going to be, I think, 4 pages is what the letters look like.
Oh, 4 pages, and it will be confusing for a lot of people. There are websites that it will direct you to, or phone numbers you can call to get questions answered, and they'll be directing you back to the tailored plan, which you will be assigned to. And remember, in this new world, you can't choose a tailored plan. The tailored plan is dependent on your Medicaid county, but you can choose a doctor in that network and a care management entity. And those will be the choices, like John said. If you need to change, you can also change those selections. Any other questions about the choice period that starts Monday? Or the letters going out?
I think just one last comment on that. If you get it and you're not quite sure what to do, you can call the tailored plan that you work with, whatever county you're from, whatever your Medicaid service. You can call us and we will point you in a direction to help you find answers. Again, we don't have all the answers, but we have a pretty good idea where to point people to get those answers in case we need to. So if you get it and you're not sure what to do, which honestly, if this were me and my family, I might come to that point where I'm not sure what I'm supposed to do next. Don't be afraid to call and ask and say, help, what do we do now? And we're happy to work with anybody that we can to point you in a direction to get those answers.
We've also had a lot of questions and concerns expressed about people potentially losing their doctors in this Medicaid transformation. And I would say to any individual or family, if you're worried about that, there will be a website that's shown in your letter that you can go to, statewide website, and you can try to use that website to figure out if your doctor's listed. It may be a little complicated. You could call the tailored plan, or you could simply call your doctor's office and ask, are you going to be in my tailored plans network? I would like to be able to keep you as my doctor. I hope you are going to be in that network. Please consider contracting with the tailored plan for your region. And then hopefully your doctor will be in the network. We are seeing the state make a lot of effort to get doctors to sign up with tailored plans, to contract with them, either on their own or through hospital systems or larger physicians groups. So it's likely that many of them will be signed up with the tailored plans. I know they're putting a lot of attention on more rural areas where there are not as many physicians, and really trying to get those folks to sign up with the tailored plan. I think it's, if you're worried about your doctor, it's probably a good idea to call your doctor.
Yeah. Any other questions on that? Linda, do we have another question in the hopper that we need to answer?
Did you guys want to go through the questions that I sent first from the, okay, all right.
Yeah, let's start there.
Okay, so initially somebody just threw in the Q&A, does this affect my child who is on the waiver? So that was the first question.
Yes.
Yes, but probably not a large effect, right? So for folks who are on the innovations waiver or the TBI waiver, you will be in the tailored plan. It's likely that your current care coordinator is busy doing training to become a care manager, and you could potentially keep them as your care manager. You'll have to choose a doctor that's in the network, And you'll have to choose a care management entity. So you could choose to keep the tailored plan care coordinator who's becoming a care manager as your care manager, or if you're unhappy with that, you could choose another care management entity to provide your care management. So in that sense, it will affect you if you're on the innovations waiver. As far as your services are considered, it will not affect you except for community navigation, and that service is going away on November 30th, as long as you're not using the employer of record model. It will only be available for people using the employer of record model at that point, and only for certain pieces of that service definition. But in general, that community navigation service is going away. It will no longer be a part of the innovations waiver.
So with that in mind, and because I've received a lot of questions, people asking, calling, talking to me saying, community navigation's going away. Oh no, what are we going to do? And that's been the source of a lot of concern and frustration. And we need to be careful with that, because even though community navigation is going away, everything that community navigation was doing will now be absorbed by care management. So the function's not going away, and probably even actually we're working very hard to absorb and to make sure that we hang on to anybody that was doing community navigator, because we see those individuals as vital to what we're going to be doing next in care management. We need those people. So the idea that it's going away, yes, the exact service is going away, but the activity and the function and the roles, those have some longevity to them because it's a critical service and a critical activity that we're involved in.
So this question may have already been answered, but since this person sent it, I'm going to ask it anyway. My son has Medicaid and Medicare, but hasn't received any mail yet from the Medicaid for enrollment. What would be my first step, or where would be the website where he could enroll?
I think first step is wait for that letter, watch your mailbox, and keep that letter when you get it. People who are dually eligible for Medicaid and Medicare are a little more complicated. If your son is also on the innovations waiver or the TBI waiver, they're sure to be in the tailored plan. There will be some instances where people who are dually eligible will not go into the tailored plan, but will be set aside in a different group called Medicaid Direct, and essentially means they'll receive their services the way they're receiving them today.
We've talked about this because dual eligible individuals raises some interesting questions, and there are still questions out there that we haven't had answers to. And just prior to this meeting, Lisa and I were discussing, we're thinking we may want to do a special webinar just for dual eligible Medicaid, Medicare. If you are interested in that, let us know, because if we get enough people saying, yeah, we would like to hear about the dual eligible, then we definitely would want to schedule that. But we know that there is enough question marks for people and families. We certainly want to make sure that if there is that, to the degree we can answer the questions, great. If we can bring in some guests from the Department of Health and Human Services that may have a better grasp of what the dual eligible circumstance is. Again, our goal here is to give you as much information as is available to us. And if it means bringing in experts, we're happy to see if we can't make that happen.
Okay, thank you. The question is, please explain any changes in the types of services and benefits for those on a tailored plan.
So community navigation is the one big change for folks with intellectual and developmental disabilities that we will see. For people who are receiving services that are funded under what's called the B3 funds, and that is funds that each tailored plans have each of the tailored plans have right now. Those services will also go away because that B3 funding source is going away. We're switching to a different kind of way to fund those services. Now, a lot of those services will be crosswalked to new services under an I waiver. That's I, as in I, but a small letter I. Like the innovations waiver, this is a different type of waiver. It'll be open to more people, but fewer services. So we're still waiting on a lot of information to come out from the state about how that will actually look. But if we're folks who are receiving those B3 funded services, those will go away on November 30th. The I-waiver services should be available on December 1st, and there will be some crosswalking over to those new services.
Great, thank you. So this question, if someone has Medicare and Medicaid or they're on the tailored plan, are changes that are going to happen, are they going to be statewide or would they be county specific?
They will be statewide, to my understanding. Lisa, correct me if I'm wrong. Originally, the original plan several years ago was to test drive this and run a pilot in a couple of select areas, figure it out, work out the kinks, and then open it up statewide probably 6 months to a year later. Between COVID and budgets and a few other things that compacted this, instead of doing the pilot, everything got moved back, and now the intent is to just do it statewide, flip the switch, go live is December 1st, 2022. So a little less than what, 4 months, 5 months away, 4 months away. So yeah, it will be statewide. The service definitions are set by the state. And it's kind of like the innovations waiver. If you're receiving innovations waiver services, actually that doesn't change. The service definitions will still be determined by the different entities out there, Alliance, Via, Partners, East Point, Trillium. Did I forget one? I think I did. But Partners. They will set the service the state will set the service definitions, and then each of those agencies will establish how those service definitions are applied in their area. And again, those are specific catchment areas. If you live in the Alliance catchment area, you're stuck with Alliance. Now, service providers is extremely flexible. It's just the funding agencies are not.
Excuse me. I'm sorry.
I'll add to that. You all probably know right now there are differences between LME MCOs and how they function, how they do business, sometimes how they authorize services, even sometimes what services they can offer, because an LME MCO right now under the rules can create additional services if they can get them approved at the state level. I'll give you an example. Both Via and Trillium have created some of their own services that people in their region needed, got approval at the state level to offer those services. So while we're saying, oh yes, there's statewide changes, they will be everywhere, and it will be the same everywhere, it would also be different everywhere. Yeah. Because within that large set of high-level parameters, the tailored plans will have the authority to do certain things differently. A long list of certain things that I can't even quote you right now, but it will manifest as differences as it does now in the LME MCO system. And so, you know, if you're moving from one region to another, you often feel those differences. It's just in the way that they do business.
Each of those entities is given a lot of latitude and flexibility on how they apply the statewide standards. Mm-hmm. And so one may do it one way, one may do it a different way. There is certainly built into the whole concept of a waiver is to give some creativity in how it comes up with how it does what it's supposed to do. And so, yeah, you go from place to place, the standards are exactly the same, but each one may apply them in a little different way, and you will see what looks like very different types of services from one area to the next.
Okay. How would a tailored plan let people know that they have a choice and who they can choose from? Will they publish a list that will be given out to individuals and families?
So that list will be on the website. And they're not going to send you a list. You'll have to go after it. You'll have to go looking for it. The tailored plans will not let you know that you've been assigned to the tailored plan, but that letter that we talked about at the beginning that's going to come from the Department of Health and Human Services, that will tell you which tailored plan you've been assigned to. And then you'll need to go look for the list, get someone help you look for the list, or call the Taylor Plan and get them to help you find the list on their website. And again, that list is going to populate more and more and more as we get closer to end of September and beginning of October.
Another question that along those lines that's come up, those lists, who's going to be on that will be any agency. The ARC's one of them. There are a number of others that have done this, that have passed several different reviews, a site review, a readiness review, a bench review. And once we've done that, we've completed contracts with each of the LMEMCO, Taylor Plans, agencies. Once we've completed those contracts, and that's all a timing, by the time we're done with this, we're expecting, like I said, those names that have finished all of those reviews and the contracts probably won't be till the 1st of October. But once that's done, that'll be populated. There are some agencies that may only work with one agency. So if you're working with Alliance and there's somebody out there that is only contracted with Trillium, you're only going to be able to find them in Trillium, and they're the only one you can only work with Trillium if that's the case. Others will be statewide. So it just depends on who decided which contracts to complete and which areas that they're comfortable working in.
Okay. Could one or both of you kind of talk a little bit about, we had a lot of staff questions about how do we see care managers and extenders working together in this new world? What does that look like for families?
Yeah, it's a great question. We're envisioning that now ourselves, and we're going to be learning a lot from families, from folks that we support, from our own staff about what that looks like once we get started. I find myself a lot reminding people lately, we have a model and a vision, but reality is going to check that model and tweak. We're going to be tweaking and revising. But here's what we think. A care manager, and you may hear the state refer to the care manager as the quarterback. The care manager will kind of guide the process of coordinating services. They're not going to approve services. They're not going to do utilization management or approve authorizations or anything like that. They're going to get to know the individual and the family and the needs. They're going to help do a plan, and then they're going to help guide the coordination of all those services. Think the community-based services you're getting now, any medical or health-related services, pharmacy service, any specialty services, let's say PT, OT, speech, durable medical equipment, help coordinate all of that. Now you can imagine that could be a lot of work for a care manager. So the extenders will be like the helpers for the care managers. And they might be helping to gather information for the care manager. They might be helping provide information for the individual or the family. They might be connecting people to resources in the community to fill the needs that they may have. We support a lot of folks who don't have enough food, for instance. Extenders will be connecting people to resources to get food when they need things like that. So we think that the care manager will guide a lot of the work of the extender. And we also think that in a more evolved system, as it grows, we'll have extenders who could specialize in certain areas. So maybe have an extender who specializes in getting that durable medical equipment, or getting a van modification done, or helping a family with an IEP, or advocating for other things that they might need. We may have extenders specialize in those areas so that they can provide that more highly specialized assistance when people need those kinds of things. So they'll be working hand in hand. And here's an issue. Families may be hearing from both. So let's say you choose the ARC or anyone else, even a Taylor Plan for care management. You're going to hear from the care manager, but you may also be hearing from the extender. And frankly, we worry about too many people being in folks' lives because it can become intrusive for individuals and families. And so we're going to be trying to balance that on the backside so that we're working together as a team but not being too intrusive in people's lives.
And at the ARC of North Carolina, we call those extenders resource advocates, and our resource advocates currently and in years past have been doing community navigation. That's why we need that translation over, and that work will still be going on. It may be that resource advocate / extender may be working directly with the family they've been working with for years, who have that connection, that understanding, and that ability to help meet the needs of the individual. The way I've tried to frame it up in my mind, when we started, we were building these models of one person here and 5 people there, and building these models of staffing. And I've started to think of it in the other way around. Rather than build a staffing model, what is the need of the individual? We know there are some ratios that the state has established that we have to adhere to, which is fine. But really, it's more about who has the best capacity to meet the needs of that individual, to connect them with community resources, transportation, jobs, housing, daytime supports, and physical health, doctors, specialists, whatever that may need to be. What is the best way to help connect that person with what they need? And that may look very different place to place and person to person. It may be that we need a care manager specifically working with this one family, but there are other places where a community navigator becomes an extender or resource advocate and realizes, I know this family better than anybody else. Well, are we going to pull them out of there and say, you can't talk to that family anymore? That doesn't make a whole lot of sense to me. That certainly is not person-centered. So the guiding principle for us is going to be what is in the interest of the family. Yes, we have parameters and boundaries that we have to stay within, but within those boundaries, the guiding principle is going to be what meets the needs of the individual. How do we make that happen more effectively?
Okay, so we've got several questions in the Q&A, but can we just take a minute and talk about, because there's lots of comments about folks who are dually eligible. We've got folks that are just saying they're interested in the information. Could we do a separate session about those who are dually eligible to learn more about Medicaid Direct? And then we've even got someone that says they are a navigator and they've got many folks on their caseload with dual eligibility. So can we just address that?
Sure, we can address that. I think what we probably need to do, because it does get complicated, is first of all, let me remind folks, if you're dually eligible, if you have the innovations waiver or the TBI waiver, you're automatically in the tailored plan. You don't have to worry about where am I going to land. You will be in the tailored plan, get services there. For everyone else, there are concerns and lots of questions, and it does get complicated. What John and I have talked about doing is maybe having a separate session on dual eligibility and having someone from the Medicaid office join us to help people understand better how those distinctions are made, whether or not you might land in the tailored plan or not. In the meantime, your letter will tell you if you're going to be in the tailored plan. But I think it might be helpful to get some of those dual eligible questions answered by one of the Medicaid experts, because there are so many different types of Medicaid, and then you put Medicare on top of that. That's one of the reasons they're holding folks out of the tailored plan, because those situations do get complicated.
Yeah, I mean, in our effort to keep this as user-friendly as possible, there are some things that we already know are not going to be user-friendly. And the question of dual eligible, we already know is not very user-friendly, only because the state hasn't figured some of this out. That's why they're holding some of that back while they work on getting the tailored plans going. And that's why Lisa and I said, hey, let's have a separate session if that's the case, if there's enough interest, and it looks like there probably is. That way we can address those questions specifically, because I mean, and again, we already know there are questions and we have them ourselves. So that might be the quickest and easiest. What I will say is, if there is an answer available, we will see what we can do to find it between now and then, and we'll try and figure out sometime in the next few weeks when we can do a dual eligible webinar. Keep your name on the list. Melinda will keep track of those, and we will certainly reach out and put the word out for anybody in that circumstance, so that you can come and join us and ask very pointed, direct questions. And if we can get the experts from the department in the room, they're going to give us the best answers and the most current thinking as it goes. And the only other thing to remember is between now and December 1st, actually between now and next year at this time, I suspect there's going to be a lot of tweaks and adjustments even to what we currently know. That seems to be pretty obvious, that there's a lot of adjustments. A lot of people came up with, we think this is how it's supposed to work. But as we start to apply these things, I think there's a lot of stepping back and saying, well, that's not necessarily what we thought it was supposed to do, so let's do it differently.
Yeah.
So we
So
paid,
there's a quick, sorry, John.
go ahead.
I was just saying the quick follow-up. One of our staff actually has weighed in and just said, for dually enrolled individuals, Medicare is the primary payer for medical service. So this should not affect the PCP provider if she's correct in her thinking. Is that correct?
You are correct in your thinking. Medicaid is always the last provider, the last payer of resort.
Okay. Okay, great. Can you all speak to how self-direction might look under Medicaid transformation?
Yeah, we're doing a lot of work around self-direction. We actually have a grant right now working on self-direction statewide, and we're finding that a lot of the tailored plans don't understand self-direction that well. It's complicated sometimes, and they don't do it. And they're not the provider on the ground helping people figure out the details. And so naturally they wouldn't understand a lot of the nuances around self-direction. And remember, self-direction can happen in two models: agency with choice and employer of record. We've been doing self-directed services for many, many years. And we have a long waiting list of families who want to move into self-direction and want our help doing that. Here's what I think will change in tailored plan world. First of all, we got to continue to help tailored plan staff understand these intricacies of self-direction. We're doing that, and we've been talking with a statewide committee made up of representatives of those tailored plans. You will get a care manager if you want to choose one. Again, care management is not a requirement. It is an opportunity. I suggest you all choose a care management entity. So you'll have a care manager in the mix, and the community navigator will still do the training for employer of record and agency with choice and the ongoing mentoring. You'll still have the fiscal intermediary company, GT or Acumen, or the two that work in the state. They will still be intact. You'll still have a community navigator. Now, there is some talk at the state level about having GT and Acumen provide the community navigation service, which will do the training and the mentoring. We don't believe they are in the best position to do that because they also don't understand the intricacies of the self-directed options. And so we're trying to advocate and educate at the state level about better options. For providers like the ARC who are doing self-directed services, with community navigation going away, they're going to be tasked with figuring out how to fund that piece of, fund the staff to do that work. And so we're in the midst of doing that ourselves right now. We think we have some answers about how we will do it, but it'll be done differently, by different providers. But the primary change will be you'll have a care manager, and hopefully you'll still have the same community navigator, but that is really dependent on the provider who's employing that community navigator now.
Great. Okay. So the last question that I've got in the queue right now is something that will resonate with lots of families, and that is we are having really serious issues finding staff. Is this person at risk of losing services when community navigator goes away?
Just
Go ahead.
because community navigator goes away doesn't mean the person should lose their other services, unless what you're saying is that's the only service we're able to get right now. And, we all know if you go too long without provision of waiver services, you're in danger of losing your waiver slot. with today's workforce crisis, I think there would be a lot of reasons to extend those deadlines for people to hear appeals on those issues. And I don't think we will see tailored plans just wiping out people's waiver slots because they can't find staff.
Yeah.
You know, tailored plans are fully aware of the workforce crisis that we're involved with right now as well. And it's a problem everywhere.
I would say that the issue of losing services and not having staff, they're they're interconnected, but they're two different issues. One is if you are authorized for a service, then you get it. If we don't have staff to provide that service, then doesn't matter if you got the waiver slot. You know, and we've seen this in several other states where they did not develop the workforce available. They gave you people a waiver slot that were on the wait list. Congratulations, but there's no one to do the service that you just got approved for. We're sorry. And then we've seen this in a couple states, New York and South Carolina in particular. That issue has been addressed and at least ways visited by the General Assembly here in North Carolina. We're looking at this along with several other provider agencies that's saying the workforce issue is not going to go away. So even though we may be moving Community Navigator over to care management, you should still have access to what Community Navigator was doing for you through care management. But we're still facing a workforce issue that, again, our legislative agenda for the coming session in January, that is high on the priority list of, and we've been talking about it now for over a year, building a workforce and developing one so that this doesn't become an issue. But those, again, they're interconnected, but they're two very different issues. You should be able to, if there is labor to fill the slot, you should be able to continue to receive the supports that was included in Community Navigator, as long as we can find people.
I'll just add to that, John. I want folks to know that the ARC is extremely aware of this workforce shortage. And we've been working for the last year with the community college system, Department of Public Instruction, the Department of Health and Human Services, and major entities trying to come up with teams of people in the right positions at the state level who can help begin to address and create a pipeline where we can begin to build staff and careers for this field. We believe that high school seniors, for instance, could be doing internships and learning in health sciences classes about supporting folks with IDD in the community. Community colleges now have a curriculum that they could employ statewide in every community college that would help train people to do direct supports and help train supervisors who are considered qualified professionals in the field. Now, those qualified professionals still have to have a college degree, but this would be extra training to prepare people to become those qualified professionals and supervisors in the field. We have a vision for this pipeline and career ladder for people to move through, and trying to put the blocks into place to get the big divisions, the big departments, the big entities in the state to help build this, talking with legislators about it too. So we've been working on this for the last year because there aren't enough people to go around. We're going to keep working on this. This is a long-term issue, but we do have some thoughts and some potential building out of this that we think is, we're making some progress on it. It's not going to be a short-term solution, but it may be the kind of solution that would move us away from ever having this degree of this problem again in the future.
And just for information purposes, because this is, again, I am anticipating this is a major keystone of our legislative agenda going into the new session in January. There may come a point sometime between January and when they go home in July, August, September, October, depends on when they get done doing everything they're supposed to do. But if there is legislation and it's struggling, even if it's not struggling, we may be reaching out to and putting the word out across the board. Contact your local legislator, on this particular bill or issue. We don't know what that looks like yet because no bills have been filed and they won't be. But at that point, we are looking at what can we do to make things happen. And this is one, the work in, when Lisa says we've been working on it for the last year, there have been conversations internally for much longer than that. And we've been aware of it and are concerned about it. And so to the degree we can build up that workforce and to make sure that when you get that waiver slot, when you get that care manager, the resources and the supports that you are receiving follow you and don't go away just because there isn't somebody there to do the work. That's primary issue for us right now.
Thanks. We had an additional question thrown in the chat and just says, can an extender do a navigator's job description under self-direction?
Karen, you are taking us into the weeds on this one. Let me think. Can an extender do a navigator's job? Yes. That depends on the employer of that extender and whether or not first, is the extender trained to do self-direction training and mentoring, help people set up as an agency of a choice or employer of record? That takes a lot of training and a lot of knowledge and a lot of skill, really. We have a set number of folks in our own organization who can do that. Some of those, all of those are currently our resource advocates. Yeah, they could roll into an extender role and they could do that if they were, here's the in the weeds issue. You can't provide care management for someone you're providing any waiver services for. So if we have an extender, if we had half an extender and half of a navigator doing employer of record, technically we could make that work. As the ARC, we could make that work. We could split that position into that person into two positions and have them dedicated to care management extender work over here and have them dedicated to resource advocacy navigator work over here. I can tell you not every provider would be willing or able to be that creative and make those kinds of assumptions or operationalize it in that way. So that gets very tricky, very much in the weeds of rules and regulations and who can do what.
And keep in mind too, because I know there are some people who are community navigator professionals doing this on contract or on their own. And so we're talking about what our structure at the ARC of North Carolina is looking like. Every other agency, as long as they meet all of those guidelines, and again, there are some basic ratios, one supervising care manager for 8 care managers, and there's some guidelines on how many extenders that you can apply to that particular team. How we apply that may be different than how somebody else does it. Again, we're talking about some creative ways to really fill some of those slots, maybe have a specialty resource advocate extender who specializes in education plans and somebody who specializes in employment. At the same time, there may be other people who are specializing in a family or set of families. So there's a lot of flexibility. How each one does that's going to be up to them. So when we start talking this way, just be aware this is how we would do it. And we're still figuring some of this out ourselves. Others may opt to do it very differently.
Mm-hmm. And another one thrown in here, it says for community navigators, who or where does someone go to investigate employer of record or self-directed? Example, where or who is the department or agency to talk to?
So since this falls under the innovations waiver, you would talk to the folks in the Medicaid office about that. And Michelle Merritt is the state employee in the Medicaid office who kind of heads this up, the self-direction aspect of waiver services for the state. She's the person we more often work with than anyone else on self-direction questions. She heads up the committee that I referred to earlier, the statewide committee with the tailored plans on self-direction. So Michelle used to work for the Arc of the Triangle. She's very good. She's very person-centered. She knows a lot about IDD services. We depend on her a lot, and she really knows her stuff. She's a good contact.
So that was all of the questions that we had in the chat. And in the QA, so submitted ahead of time or live. I hope that we've gotten to everyone's question. So I think that that's probably a good place to end for today. And know that we have heard you about a separate session for dually eligible folks. I believe that we already have a date for our next whole group session, and I believe that's September 9th. Somebody correct me on this if I'm wrong, but we'll get information about that shortly. John, Lisa, were there any final things that you wanted to add before we let everyone go?
Just a final thought, and we talked about revisiting, and somebody actually asked, are we going to, what's the status of these letters that are going out? I wanted to make sure and repeat what we said when we started in case somebody missed it, because this is kind of critical. The letters from the Taylor plans should be going out beginning the first of next week. If they're not already in the mail, they will be being put in the mail. You should receive that sometime next week, if, unless there's some hiccup in the mailing system. That said, once you get that, it's 4 pages from the Department of Health and Services, Department of Health Benefits. Is that right? I got to go back and look.
Division of Health, Department of Health and Human Services, Division of Health Benefits.
Division of Health Benefits. Thank you. And it's going to have some information in it. There's a lot. Again, it's 4 pages, so it's a lot to wade through. The things to pay attention to is there is a link to where you can go to sign up and find the lists of providers that you can work with. Those lists are not populated yet. So even if you were to go out today, you could go and find the site, you could enter all the information, and there would be nobody there for you to sign up to work with. The deadline for signing up is October 14th. So there's a lot of time to be able to ponder and wait and ask questions. We're not sure. It doesn't take very long to fill it all out, but don't be in a panic and don't be in a hurry. And if somebody says you got to do it today, don't worry about it. You got till the 14th of October. We expect that those lists are not going to start getting really populated with outside providers until probably the end of September, 1st of October. So there may be a 2-week window where you really have some good choice. The choices are available. The window is open as of Monday, but you may not have a really good selection to work with until all those contracts are signed and they put them into the system. And that's going to take some time.
Right. Okay. All right, everybody. I confirmed our next whole group webinar will be September 19th. I believe that will be at 4:30. We will get information about that shortly so that you can get it on your calendars. Hopefully, we will also have some fresh content because we will have more direction coming to us from the state by then as well. But you can continue to use that link to send questions to us. We'll keep that open and make sure that we get those answered live or as a part of an FAQ. So thanks, John and Lisa, for managing this today. And thanks to all of you for attending. And we will be in touch soon. You guys have a great afternoon.
Thank you.
Thanks, everybody.